Good morning. This is the Board of County Commissioners Board Work Session. It is Thursday, October 5th, 2023. It is 9:06 a.m. This session is set to go until 11:45. Then we will be taking a recess from 11:45 till 1:30. We will pick up at 1:30 and go till 4:15. This is a hybrid meeting. We're at 3000 Pacific Avenue Southeast, room 110. For public virtual attendance, you may follow along on the Thurston County YouTube channel. I'm Carolina McKee. I'm the chair of the board. Vice Chair Ty Menser is in the boardroom, as well as Commissioner Gary Edwards. We have interim county manager Robin Campbell, as well as assistant county manager Rob Gelder. And we are picking back up. We have the budget team present for the 2024 through 2025 budget presentations. And Nicole, I know we have the coroner starting us off here today, but I'll pass it to you, and then we can pass it to Coroner Gary Warnock.
Thank you, Commissioner. Yes, good morning. Nicole Martinez, Budget and Fiscal Manager. We're here to speak about budget presentations concerning the 2024-2025 biennium. Today is just going to be informational. This is just to share information about departments and offices for policy level requests for this biennium, and we're going to kick it off with the coroner, and so I'll pass it over to Gary.
Is this a state requirement?
Yes, to be able to present the budget presentations to the board as well as any policy level requests. This is by state and also by good practice for budget processes.
Sure. Okay. I'd just like to have the public know kind of why and what we're doing.
Yes,
thank you.
Okay, thank you. Gary Warnock, Thurston County Coroner, and I brought with me my lead investigator, Tracy McCullough. She pretty much did all this, and she's going to be here to help me to go through this. So the goal of the coroner's office is to conduct comprehensive medical, legal, death investigations, always mindful of the health, safety, and well-being of our residents. Compassionately support the family, friends, and coworkers of the decedents during the time of their loss. Deputy coroners and investigators are available and on call 24/7, 365 days a year. When an autopsy is necessary, our goal is to perform timely autopsies, utilizing high-quality technicians to assist. These numbers here were provided by HR Financial Services. You want me to go over these, Robin?
This is your budget.
Okay, well, FTEs currently we have, well, we had 10, we have 11 now. We hired our autopsy technician beginning of the year. And we're proposing 2 more FTEs going through 24 to 25. Okay, go ahead. Our challenges for the next 2 years, 24 and 25, is obtaining office accreditation. There was a state law that was passed that all offices in the state must be accredited as far as coroners and medical examiner offices. We are in a unique position to offer our facility to the surrounding rural counties who do not have access to forensic pathologists. Currently, we have Mason, Lewis, Clallam, Yakima, Benton, Grace Harbor, and what's the one in Eastern Washington? Columbia County. So they're utilizing our morgue as a rental space to do autopsies, and they pay us a fee for that. Currently in the state, there's only one forensic pathologist that travels east of the Cascades. And they're in a bind, so the rural counties are bringing their cases west to the I-5 corridor. And let's see, by coming accredited, we'll continue to receive reimbursements at the highest rate. If we don't achieve accreditation and individual certification, the state will withhold 25% of our reimbursement. And our current reimbursement for 2022 was just over $235,000. Year to date, I just submitted the reimbursement and I think we should have received 134,300 so far this year. And facility fees paid last year was 42,400 and we're on, well, year to date, we're at 52. And yeah, so it's between 7,000 and 10,000 a month is what we bring in.
Can I ask you a question on that?
Sure.
This accreditation, otherwise you lose 25% of reimbursement, is that a new rule or is that a certain period of time that we needed to have accomplished
We
it?
have until 2025 to be accredited.
And that was because they passed a law some years
House
ago?
Bill 1326, I think it was. Yes,
1326?
yeah.
In which year, Gary?
When did they pass it? Last year. So they're giving the counties 2-year leadway to,
What is the penalty if it is not accomplished?
you don't get your reimbursement. You don't get the full reimbursement.
So you'd lose that 25% reimbursement? How many autopsies did you do last year, for an example?
335.
What is it, 335.
What, do you have an average cost? I mean, like overdose, for an example, versus a homicide with a shooting or something like that. I mean,
So let me back up a little bit on the autopsies. So that's a grouped number. So for every 5 external examinations where there's not a surgical procedure where there's an autopsy, 5 external examinations are equivalent to 1 autopsy. So all of our autopsies, examinations are all combined into one. So I would be happy to break out our autopsies and our external examinations, just so you can see the comparison, that they're not all autopsy cases, but they're in the same pool.
When you say 5 are equivalent to 1, equivalent in what way? The time spent to do them or the money?
Pretty much, yeah, time. So 5 externals is equal to 1 autopsy.
just basically a 5-to-1 ratio.
Correct. Yeah. And as far as the overdoses, we don't autopsy every overdose case. So in the age group in the overdoses are in the 20 to 40 year range. And if you get that group of people, they don't have a significant medical history that would cause death. But if we do have somebody that does have significant medical history, we're gonna pull their medical records and we're gonna run their tox. We're not gonna do an autopsy because we have their medical records that have significant history. And we'll run their toxicology. If that comes back negative, then we have something to fall back onto to sign it off as a natural death. But if it's positive, then we're gonna pin the certificate, and if it comes back positive with drugs, we're gonna write it off as an overdose to whatever the cocktail of drugs were found in their system.
When you, do you send in for a toxicology on each individual? As a general
The
rule?
majority of them, yeah, but not every case. You get a natural death.
Somebody's 89 years old and died at home
Sure.
after being released from the
We have to
hospital.
have suspicion that,
Yeah, okay.
Traffic collisions, we're gonna run talks to make sure they weren't under the influence.
How many natural deaths would you guess we have compared to like overdoses and traffic accidents and homicides?
Natural
Maybe
death is the
half.
leading manner of death, regardless, but as far as cases that we bring in, we have a lot of people who don't have doctors in Thurston County. They don't have them, or they don't like them and they just refuse to see their physician. And when they die without seeing their physician over, say, 2 years, those fall on us. And then, so we're gonna pull their medical records to see, we're gonna rule out, possible overdose or anything untoward circumstances. And then review their medical records, and if we have significant medical history, we can sign those out as long as we've ruled out foul play. Okay. But we do see a lot of natural deaths. current medications on hand. Even though they haven't seen their doctor for a year, they're still getting a prescription.
Thank you. Gary, I have a question in regards to reimbursements.
Yeah.
So those figures that you have listed there, 2022 reimbursement was 235, but what was the total that, I mean, I remember there being a event because we had to give, we had to supplement that autopsy because there were so many deaths. I don't remember if it was around like 300 or 400,000. Robin, do you remember?
Right, it was around 400,000. The board put additional funding into the coroner's budget last year.
And so I don't know, the reimbursements that we're getting doesn't kind of really match that. And I'm just wondering how the reimbursement is calculated that you submit to the state.
So currently it's 40%. And it's not just the autopsy costs. We can, any lab fees are included in that. And then infants, 3 years, and younger, the county gets 100% of that back. So it's 100% of the autopsy, 100% for outside lab testing. We get 100% of that back for infants, but only 40% for 4 years and older.
We only get a fraction of the cost of our autopsies reimbursed, not the entire amount. But even that adds up to $235,000 in 22.
You get the 40%. Yeah.
Yeah,
And then I guess on that 40% of the 40% that you get back on the autopsies, they're going to withhold 25% of that 40% if you're not accredited.
Correct.
so are you saying that we would only lose about $60,000?
I
If,
didn't,
for example, in 2022, if they're only gonna withhold 1/4 of what they reimburse, we would only lose like 60,000. Is that?
that's accurate. Plus you would lose the revenue for the other counties that use our space because they would no longer be allowed to perform autopsies in a
In a
unaccredited.
non-accredited
Correct.
facility? Okay, so approximately how much would, so that's
100,000.
another 42,000 had with this been happening last year,
Right, so
So
about
we lose $100,000.
roughly $100,000.
Okay, if this is dying or not dying, that's kind of a public health thing. Where am I going with this, Robin?
Foundational public
Yeah,
health.
why is it that foundational public health is not covering this cost, this budgetary item, and the other piece of it? Why is it not an unfunded mandate that we can bring litigation against the state over? If Gary's under a requirement, it's gonna cost X number of dollars, and it's per RCW, why don't we bring some action either against the state? And, we're all gonna be I think if we do something, other counties around the state might follow, and maybe we can do a class action thing or something. But if it's a requirement from the state, we have to have some relief from our general fund, and that's where either relief from the state or the foundational public health. I mean, nothing is more, health related than keeping somebody from dying or finding out why they died, I guess.
So let's start with the unfunded mandate. The state would tell you that it's not an unfunded mandate because they do pay for part of the county's expenses.
Well, they're
Not
changing the rules,
100%.
they're saying they're not gonna pay.
If
and
we're
that's gonna
not
cost us
accredited,
more money, so we need to do something about the number of
right,
autopsies.
they're telling us that we have to meet certain criteria but they are paying us, so that is
But they're
not,
not paying for that criteria necessarily to be
Right.
implemented.
but overall, we would not fare well in court for an unfunded mandate for this particular item. As far as public health goes, foundational public health funding, since it is a grant from the state of Washington, they get to define what we can and cannot charge to that. And autopsies or
Does
coroner
it specifically
expenses
say
does
you
not.
can't? Does it say you can't? If it doesn't say you can't, I like to press the envelope and do it and see what happens.
We could certainly contact the department, the Washington
Well, I
State
wouldn't even contact them,
Department.
I'd just pay it out of
um,
foundational public health.
In which case, we would come up with an audit finding and have to pay the money back, which I
if
would
we-
rather avoid, but,
Let's see what the prosecutor says. Where's the prosecutor at right now? How come we can't get some advice from the prosecutor?
we can get advice from the prosecutor, we will. We will reach out to Elizabeth, she often advises
Cause
us
there's only a
on these
couple
things.
options here left. We don't have any money. So what, do we say we just don't do any autopsies or only do
No
10%
one is
of what we're
suggesting
doing?
that. Nope.
Well, that might be what we're up against.
Oh,
And
you do that,
Gary
and we're
could,
up for a litigation.
There you
Sure,
go.
I know we are. So,
We're gonna get sued.
and, well, you get sued, we get sued. It doesn't, it goes hand in
I
hand,
mean, we're in the same pot.
sure.
Okay.
right, and you have, told us before that you are already doing the minimum required by law, is that
That's-
accurate?
That's correct. And when we move to the standards, there are certain cases that have to be done, which sometimes we don't do. The hospital deaths, we just do review medical records and do an external and that's it.
Somewhere, something's gotta give somewhere. I'd rather hire adequate people than pay for things that maybe we can get away with.
Doesn't the accreditation piece, wasn't one of the pieces that we have to have a particular kind of employee?
I'm sorry?
That we have to hire somebody, there was a position connected with getting the
Chief
accreditation.
deputy.
Yeah, so that seems kind of unfunded mandaty to me. You gotta do this, the law says you gotta have this thing, you gotta have this position.
So we have to cover the coroner's office so that they can respond 24/7 to calls. That's the way we address it. Is that required in law? That you
24/7?
be able to cover
Oh, it
24/7?
doesn't mean
I'm sorry, what?
we are on call 24/7 regardless if we have enough staff or not.
Right, so we could choose, this would not be ideal, but the county could choose to take one of the current positions and reclassify it to deputy coroner, and they would still be minimally staffed under state law. That's certain amount of policy falls to the county, which is why we would not prevail in a unfunded mandate suit.
You said deputy, coroner, you mean chief deputy.
Chief deputy? Yeah, yes.
Now, I know Commissioner Edwards, you go back a bit, but I can give you a little history on the Forensic Investigation Council. Back in the 80s when they designed the autopsy reimbursement, it was designed to give money back to the counties to invest into their coroners and medical examiners to do more autopsies. That was the whole purpose of the reimbursement. Because they knew it was, you know, the coroners and medical examiners throughout the state are the least funded departments
Yeah,
in every
we've
county.
been behind the eight ball for a long time.
Sure.
Yeah.
And we're constantly, you know, trying to catch up to our, you know, our comparable county like Kitsap. And we're still behind them, even though we have a heavier population and a heavier caseload.
But inflation is eating us up. And that's what
It
we're up
is.
against. And revenue isn't matching. Whether that revenue is from a multitude of different sources, it's down, way down. And that's what we're up against. And so what do we do to figure out a way around that? Therein lies the problem, and we gotta discuss all of these issues because we don't know which ones might work out. I think the foundational public health is an issue that we can certainly look at.
We will definitely get a legal opinion on that.
And I've asked them also to come in, when they come in next week, to talk about foundational public health and uses as well.
Good. All right, so let's move on to the next item.
So our challenges currently are hiring a board certified forensic pathologist. That is still an open position. As you're aware, there's a national shortage, and I explained that earlier, that Washington State is, we're feeling the pinch as well, and so are our peers in Eastern Washington. So we currently have 3 pathologists that contract work for us. 2 of them, one came out of retirement and the other is nearing retirement. So we can foresee our 2 retirees retiring very soon, which just leaves us with just one that we call upon. 2022, we paid $502,000, $450 in autopsy services. Reimbursement, we did that already, was $235,000 for last year. And our approved budget for our forensic pathologist currently is $250 plus benefits, which comes to $282. And then, yeah, so autopsy reimbursements will be at a lower rate if we don't, what's that? Pathologist is so if the pathologist is a county employee, we no longer get the 40%, we would only get 30% at their salary.
But overall costs would be significantly less.
Correct.
Yes.
They also, if I understand, sorry to interrupt, that they would also have certain caseload standards by which they couldn't exceed those, right, prior to dealing with the issues of accreditation as well.
So there's two organizations you can be accredited by. There's NAME, which is the National Association of Medical Examiners, and there's IACME, the IACME, which is the International Association of Coroners and Medical Examiners. Their standards mirror each other, but there are some, they're not balanced. So the IACME may say that if you have a pathologist that does work for, they're your employee and they can only do, I think it's 250 is like where they would like to keep it, but you can't go over. Once you hit 325, then you're in danger of losing your certification and accreditation. And I just learned 2 weeks ago that if we do have a forensic pathologist in-house, that number is only held to our office. So that means that pathologist can do other work for other counties and not be deemed for going over that limit.
Where are we at in the interview process? Last time you came in front of the board, you said that there was an applicant from
Elsewhere.
eastern, the eastern part of the,
Oklahoma, I think.
and so where are we at on,
Still there.
so the applicant didn't work out?
We just haven't moved forward on it. I'm hoping to get more than one applicant.
I guess if you can't get, though, what do? That person would come here, is that what you're saying? If you offered the job, but you're not it sounds like you're not quite ready to offer that. It's your call, And if you don't get it, if we're short, what do we do?
There's people out there.
We aren't paying enough or what?
Yeah,
What are we at? Where are we at now?
250.
Well, I mean, they're making, because they're touring around, right? And
Yeah.
so they're getting more than 400 because then they're collecting from other counties, so.
What's Kitsap paying theirs?
North of 250.
Yeah.
I don't have the exact number.
The salary and that position is based on 1 day a week of working. That pathologist, 1
For
day a week.
Kitsap,
So that's something to keep in mind as we're considering.
can we do something like that? A part-time position or something and,
Oh, it's not gonna be a part-time, it's,
well, I know it's not part-time, but maybe if we got them here to sign up and be part of our crew, if you will, even 1 day a week, I don't know how it's working over there, but
I think
let
Dr.
them
Harrell
go,
is there.
you know, let them do contract work for us or something
And
after that point.
what's that?
contract.
I'm open to a contract. If I can't get an employee, staffed, I'm totally open to a
And
contract.
that, and the reimbursement is,
We get 40%,
we'd get
because
40.
they're not a county employee.
Well, then that'd actually be better, wouldn't it?
Yeah,
So what would it take to pull that off? I mean, we gotta do something. How much more money though?
well, if we're paying $502,000 for autopsies right now,
Yeah, why don't we pay 400 or something, right?
well, I wouldn't say 400, but
Well, why
if you do
not?
400, then you're gonna have a fight in the state with people saying, hey, they're paying Thurston County 400, so I want 450. We gotta keep it,
Okay, well, if we raise the threshold of what we are willing to authorize, would that help you get somebody?
How much are we talking about? How much do you think is enough? If you're telling the board they need to put more money in, you need to say how much more.
I would say at least 275 to 300.
So, and you've got 250
Yeah,
in the budget right now if you should fill the position.
correct.
So you would, if they put in an extra 50,000, then you could get someone under contract?
I would think so. I'm not certain, Robin, but it's worth a shot.
We
I mean,
need to know
have
how
do
much.
Something.
Well,
I never got the, sorry.
No, I never heard that part.
I never wrapped back to the original question. Last time you were here, it seemed like you were somewhat excited
There
about the
was
candidate in Oklahoma. Now the body language
Well,
I'm
but-
getting is you're not excited about that candidate, so what?
Well, I'm not excited about it because it's only one candidate. I mean,
We only need one
you
person.
guys apply for an open position and you only get one applicant.
Depends who that
You're gonna
applicant
send
is.
it out, I'm working with a recruiter.
Yeah.
And they're supposed to be broadcasting it elsewhere, but I'm only getting one so far.
If it's, okay, well, I mean, for me, it's like, I don't
One
really care how
highly
many I have, I care about
qualified candidate
it's quality,
would
not
be
quantity.
perfect.
If I have one good candidate, I'm stoked. If I have 5 crappy we did public health, we interviewed people after people after people, we had plenty of candidates, they weren't good. And we waited till we got the right person, so it's quality, not quantity.
Yeah, I'm not stoked on one applicant when I know there are others out there that, move around and they're just waiting for that other shoe to drop and then they'll jump on it. Yeah.
It's all about money, huh?
Well, I just.
Well, we don't
If
have
the-
any
if,
money.
Well, yeah, that is the thing, right? We have, if there's one, like you're putting the board in a very difficult situation
Oh.
because there is no money. Like
I-
that's the bottom line.
Yeah, we're in a tight spot too.
And, pretty much what we're facing is your office is just not gonna be accredited. And, while we might be losing 40% of this and we might not get that, I mean, that still doesn't even cover the deputy coroner salary, right? And so those are the choices that we're debating right now. And one of your top priorities, right, kind of skipping ahead, is the increased autopsy cost, which is 420,000. And yet, if there's a qualified applicant, well, I know it's only one and you want to have a little bit more, there's, just a whole nother increase of 420,000. And it's just, we're kind of debating, a chief deputy coroner and also like a forensic autopsy, and I know you'll talk about those positions later. But just seeing at those costs compared to the reimbursements we get, it's just not adding up. So can you like walk us through that, right? Because right now, it seems better to lose that accreditation. Because what we're losing is not, won't even cover the gap
what
on
they put in.
on this other stuff.
So what do you want me to add up?
So just, can you walk us through that process?
Go ahead.
Can I comment?
Yeah.
So what we would look at if we hired a pathologist under the 282.033, that pathologist would then be limited in the number of autopsies that they would do each year. We would still ask for more money to cover when that pathologist is out of town or unavailable or has reached the maximum. So the 282 isn't going to be the end all be all if we hire someone. We'll still need to have that autopsy extra budget to cover. If we look at a contract, we would still have to have that extra money to cover when the contract pathologist is out of town for whatever reason. So if we look at a contract of $300,000 a year, plus we have the $50,000, we're looking at $350,000 to contract with one pathologist and have backup for them when that one pathologist is unavailable. That would be the simplest route for us to take that I see. We would still then be able to get our reimbursements at 40%, which helps to allay that cost that we are putting out for a pathologist. Does that clarify anything?
So you just,
Sorry, when you said 282, what is
The
that?
282 is what's in our budget right now, total, including the benefits, so am I not to include that? So if we
Oh,
look at just
okay.
250 for
What's
salary.
what's the total well, the 282 is the total pathologist budget, but what's the autopsy budget?
50 right now.
50,000 to cover the extra.
plus how much extra did the board have to add in to cover all the costs?
It was 330 in Amendment 3 was the additional cost for autopsies this year.
So the total autopsy budget this year is how much?
380,000.
380,000.
We are currently, just with autopsies, we're at $570,000 spent this year.
So we're gonna need the difference between that plus whatever we spend between now and the end of the year. And that's gonna be 420.
So, excuse me, now until the end of the year, we're fine. We should overall be fine as the fund goes. The 375 that was calculated that we would like for just autopsy, that was calculated because, we took the projected costs of all autopsy costs. That includes externals, autopsies, infants, homicides. And that price came out to $704,000 is what's projected for this year. But then what I took into account is I took out the 50,000 of our current budget, and I also took out minus the pathologist position of the 282, and I came to around $375,000 for increased. I apologize if that doesn't quite answer your question.
So
Well, it does, but it's, cause my question was, is the 420 on here, is this an add? Or is this, like the new recalculated total
Excuse me.
for that line item?
420 is the add. There would be a request for 20,000 increase for indigent cases, and then $25,000 requested for extra help. If it does help at all, we are projecting our revenue for next year and 25 currently right now to be $202,000. So that would, the 420 minus the 202 would bring it to 218, if that is enticingly helpful at all.
That's just for the autopsy reimbursement, correct?
Correct,
Yeah.
yes.
That doesn't reflect the revenue coming in from the other counties utilizing the
true.
office.
And I have noticed, if it's helpful, this year, the revenue coming in from the outsourcing from the other counties, we've brought in currently 52,000. So we're up 10,000 from, anyway, improv doesn't.
So can we get away with 150,000? Is that what I'm hearing?
So one of the things we spoke last time, I'm sorry, I interrupted you. Go ahead, go ahead.
No.
I interrupted Robin, so we have a cascade.
We got a dilemma, that's what we got.
So one of the items that we spoke about, when the coroner came and made a presentation, right, and he was talking about the issues with hiring was, if you were to hire a pathologist, right, but they could still contract out with other counties, then could we kind of tag another fee onto that since they're using our location? And so if counties say, we want to use your location and your pathologist, right, the pathologist can charge their rates, but out of those rates, the county would get a certain percentage for the use of equipment, location, and maybe, so let's say we would get, I don't know, 25% of, that's, I'm just throwing out a number of 15, I don't know exactly how that would work. But if Grays Harbor County said, I need a pathologist and the location, we would charge them for the normal that we charge them for the fee, right? And then the pathologist would charge them specifically, certain amount, okay, this is how much it costs to do a pathology, an autopsy. And then out of that, we would get a certain percentage. Gary, you mentioned at the previous meeting that that's something that maybe you thought would help you in hiring, where we wouldn't have to increase our, so can you kind of?
Yeah, so if you recall, we brought up the discussion about how the clerk reporter, even though it's a full-time position, they're being paid by the defense or the attorneys while still on the clock. And then Commissioner Edwards says, well, the sheriff's office does that because patrol, Costco or Target will hire deputies to show up and secure, do security for their store while they're on the clock. They're getting paid and they're getting, a stipend from the store to do that. And then Carolina says, well, why can't we do that for the coroner's office? And I said, well, why not? If someone else is doing it, why can't we do that? So that is something that we're gonna talk about. I don't know where HR stands with this as far as how do we, if the pathologist is on the clock and they're doing a case for an out-of-county case,
Well, does it,
how do we do the math on that?
We do have personnel rules and I would wanna consult with Maria before we go
yeah,
there.
because is the pathologist considered an hourly employee or are they coming in kind of like in that 24-hour service rotation as autopsies are needed? And, are they coming in on the weekends? Are they coming in?
So they would be a salaried employee, most likely MTP, which means they're exempt from overtime.
Right.
Much like, most likely at will. But again, I'd want to consult with Maria about the ability for someone to earn money while at the same time that they're being paid for similar work. We have rules about external work.
It's,
So, and I'd need to ask Maria.
yeah, it's already happening, at the county, so
It's
it's
kinda late.
just like,
There are rules, if there are offices and departments that are doing that, we need to see, hopefully they are following our policy. It does not prohibit external work, but there are rules about it.
I would like to look into that. If that's going to kind of,
I would like
if
to
it's gonna
say,
sweeten the pot for us without
Yeah.
us having to do an additional increase, right? An additional increase in salary when we're already facing these, and it's gonna assist in, bringing in a little bit more of revenue, even though it's not much, because it would be only a certain percentage, I would be open to that instead of doing these increases, these blind increases in salary without knowing, like, is that going to bring people in? Or is what bringing people in that kind of flexibility in there? Or, maybe it's not an employee, but more of a contract way that we have to go through in order to do that. Not sure, but I really want us to kind of open it up, because I think we're standing here, right, with, not to say that it's not needed, because we've seen the increase, we've seen
It's
the
not a,
rates,
it's not a want, it's a
not,
need.
yeah.
Yeah.
So it's not arguing the fact, but I just want us to try to think outside the box of, like, how can we hire this position? So this huge impact that we're seeing in autopsy cost every year at least goes down, and it's a little bit more manageable for us and for the coroner's office.
Right,
So
and
that's-
I'm not saying that they could not make agreements with other counties. I mean, we've done that in other instances, like our public health doctor.
I don't wanna get in the micromanagement business of the coroner's office. He's a separately elected official
Either.
and
I don't wanna break the law either.
well, I don't know about the law. You might
HR
create your
rules.
own law to a
There are
degree.
policies.
Yeah, your own policies. I mean, I know when I was sheriff, I went against HR quite a few times over the years and just said, to hell with you, I ain't doing it that way, I'm doing it this way. And there was no consequences other than the county could have cut my budget, I guess.
Right.
But we're not looking to do that, we're looking for a solution. And so for you to lay it out and say, well, my employees are gonna do it this way, do you hire through the county HR?
No.
Don't you hire your own people
Yeah.
to do your own thing, right? And
In
that's,
accordance with HR,
Well,
well, not,
you know, he gets
you
to,
don't have
but we
to.
I'm
recruit,
supposed
we
to follow
hire.
their rules, but sometimes I don't.
Yeah, I mean, and I think that's great. You gotta tell them to go pound sand once in a while.
Oh, I don't tell them that.
Well, I know you'd be politer than that, but somewhere along the line, you gotta do what you gotta do. And we went through a case after I left office, and I believe it had to do when Kimball was sheriff, and the board tried to tell him what he could or couldn't
Oh, I
do.
remember that.
And he prevailed on that. And I think, I've got no intention of telling you what you need to do. We
Noted.
can only give you money. That's
So,
all we can do.
You could do a little more
You
than
can
that,
do it.
but
But,
take a time check.
yeah, and so we have the next presentation at 10, so we kind of want to give you that opportunity to go through your items, since we kind of
Okay.
jumped ahead and just interrupted, but,
You can tell we're in a pickle.
Oh, yeah. And I don't wanna be adversarial either. It's just, I mean, we're in a tight spot, and we've been in a tight spot for years, so. So, did we already do this one?
No.
Okay. Increased autopsies, we pretty much talked about that. Indigent and extra help budget. So, right now, I wanna say last year we ended with 57 indigent unclaimed. Was it 57? Oh, okay. And right now we're at 21. But usually towards the end of the year, the funeral homes, if they can't find family, they sometimes don't call us, and they sit on them for 90 days. And then towards the end of the year, I get a stack of invoices from the funeral home for indigent unclaimed. So I foresee that number probably jumping into the high 30s to 40s by the end of the year. But I don't think, excuse me, I don't think we'll see 50 plus indigents like we did last year.
Why is that? Why would you think
Well,
we'd
I
have
think
less?
this time by June of last year, we were already at 25. And so we were on track to do 50 plus, but we're below that right now.
I'm sorry, on this point, the money that was put in that you made reference to last year, was that treated as a one-time infusion, or was that built into?
It was tagged as one time because the assumption had been that if the pathologist position were filled, that would negate the need for the increase in costs, but what we're hearing now is it won't.
Right. An extra help budget expenditure, so right now I think our extra help is 26,000.
Just under.
Yeah, just under 26,000, so, I have one, FTE who is on maternity leave and she's out till December. And I have 6 investigators to run a 24/7 operation, so I've got one that's home until December. We've got extra help that's coming in to cover those shifts. But if I have someone that's on vacation or I send 2 away for training, because our training, I can't send the whole office to training, so I have to send them 1 or 2 people at a time. I'm relying on extra help to backfill those positions. And overtime is not a preferred method right now for my office, because I'm just short-staffed. Right now, they're pulling 10 and 12-hour shifts. And if someone is sick or on vacation or training, someone's gonna have to backfill that shift.
Would on your third item is the forensic autopsy tech, would giving you that have a corresponding reduction in the extra help budget on the first item?
Oh, yeah, because right now our autopsy tech is the only one who does their work in the office. If that person is on vacation or sick time, I have nobody that's trained to do that job. So there would be no autopsies being performed because a pathologist, the pathologists that come in, they do the dissecting. Your autopsy tech is the one who does all the incisions. They remove all the organs, set everything aside, and then your pathologist comes in and then they do their slides, take any samples they want, and then they walk out, and then the tech is the one who puts the body back together and gets them prepared to send to a funeral home. And right now, prior to that position, we had an extra help person who did it for 50 years. And then he died 2 years ago, September, I think. That's what he did every day. And right now, it's a full-time position and there's nobody to do that work right now. So, yes, I'm asking for an autopsy tech as well.
Okay.
I will say this was all worked on prior to the announcement of the 8% cut, so some people who were watching this, that stings a little bit, but this was already done before I got that email.
Everyone is in that same
Okay.
boat. It's okay.
We had also made requests too that we went through yesterday where we were like, if we, these were our wants, and yesterday was like, well, no, like we can't do that anymore, but this was submitted before we knew about it, so don't worry, we understand that.
Okay. FTE Chief Deputy Coroner position, this is gonna be a position that is given authority by me. Right now, when I go on vacation or I'm away at training, I'm still it. I don't have anybody in the office who has office control. If I wanna sit on a beach in Hawaii, 2 phones come with me and I'm still working. I don't get any time off. Saturdays
You
and
gotta go down
Sundays.
to Long Beach, I think, where you enjoy
Yeah,
that
I ain't going to
distance.
Long Beach. Yeah, I still take media calls during the weekends, just because I don't have anybody else to give that authority to. So a chief deputy is gonna be, in my back pocket and have authority over the office. This person will, spend most of their time preparing the office for certification, or the staff for certification and the office for accreditation. And I will say that I am the only elected official that does not have a chief deputy.
It's a sad scenario.
You know, and I understand Romero and his stress because I have this stress anywhere I go. I can't go on vacation and, you know, I can never get away. And I already talked about the forensic autopsy technician.
It is 9:57. Gary, if it makes you feel better, I also have my two phones whenever I go on vacation and I get calls too, even when I am away and answer messages, so I understand.
Yeah, I understand the position I'm in. I mean, I know when I took this role, it was 24/7, but to not have someone else in the office that can, you know, do some of the administration, pay the bills while I'm gone, it's me. I still pay all the bills.
Okay, well, thank you so much for coming. Any additional questions or comments? Warner?
Not right now.
Okay, 9:57, you're adjourned. Thank you.
Okay. If there's any questions.